It's live. Hello, Caitlin. Hello. Lisette and Dusty. I love it. Welcome. Okay, guys, let's get right into it. I'm Dr. Tammy, and I am here to share all things hormones. And if you guys have any questions, please feel free to drop them in the chat. And I am a doctor family medicine doctor, but I got into bioidentical hormones, and that's my passion. So if you guys have any questions, all things hormones. And tonight, our topic is, why did my doctor say that? So as a medical doctor, like I say, for almost 25 years, and I've been in some form of the medical profession probably since I was a little kid, because I had sickly parents. I can tell you that I have seen just about all of it. And my mission is to spread the truth and to share some things and some knowledge that you might not have ever heard before in relationship to hormones, because there's so much information that has been misrepresented. And it's just absolutely terrifying to me as someone who is a 55-year-old woman on hormone therapy, and I would never want to be without it. So, hi, Doreen. So, just a few housekeeping things. If you like the content tonight, if you would just tap the screen and show some love with some little hearts there, or there's a little share arrow and you can share with your friends. Hi, Constantina. Hi, honey. So that helps the algorithm know that we are having a wonderful conversation here. And I have also, and I'll say this again a little bit later, I am going to start doing Mondays, Wednesdays, and Fridays, just so I can have a little break on the weekend and spend a little time with my family, because it's almost impossible to do date night when I do every single night at 7. But I'm a creature of habit, so it's really hard for me. Like, I'm having a little anxiety thinking about not being here tomorrow night with you guys. So know that I will be in spirit with you. But yeah, I am going to take a little break this weekend. So absolutely. And I might pop in with a few little random lives here and there. So I might not be able to stay away, but it'll be just like kind of surprise. Thank you, Constantina. And I'm a little under the weather still, so please don't make fun of my Rudolph nose. I was just rubbing it a few minutes ago, and it's like quite red on here, but it's all good. I just sound a little bit funny. So again, thank you guys for being here. I know you could have been a million places. So I always love to share information that you might not have ever heard before anywhere. And I do, in my link in bio, have lots of free information that you can download. And I also have a link that you can go, and if your doctor won't order hormones for you, if you have been struggling with that, you know it's your hormones and nobody will check, go to my link in bio or go to hormonebliss.com and order a kit, and let's see what your hormones look like and see if we can get you some help. Okay, awesome. So let's jump right in. Last night, I started the conversation of, why did my doctor say that? And something popped into my head today, and it was, there used to be a show. Yay, you sent your sample in. I love it. Oh, hi, Elaine. I love that. I'm so glad you did. There used to be a show called Kids Say the Darndest Things. And I think about that sometimes, because it's just, I don't think it's from a place of wanting to do harm. I think that a lot of doctors really are well-meaning and they're great providers. And it's just that they have been so conditioned, and I call it indoctrinated, and the things that they understand, because big pharma is in there and they're all just trying to get their piece of the pie, and doctors are overworked. And unless they've had issues, like I've had hormone issues my whole life: endometriosis, ovarian dysfunction, dysfunctional uterine bleeding, infertility, fibroids, and all ended in hysterectomy. And so I've had just about everything. And I say God does things for us and not to us, because I just don't know if I would have ever gotten outside the box to start asking questions. I've always been a question asker. I'm always curious. And so I'm like, is that really true? But I really think that it was those things that drove me. And being a female who had all these hormone issues, I think that's really where my passion came, because like I had to learn it for me. And then it's like, okay. And then just God brings me patients over the years and they're like having stuff too. And I'm like, okay, well, I think God brings our tribe to us when they need to find us. So if you're here and this is your first time here tonight, I don't think there's any accident that you found us. So if you've been tired, gaining weight, feeling bad, dysfunctional uterine bleeding, you're postmenopausal, you're perimenopausal, and you're like, no one will listen, and you're starting to feel crazy, then you have found your tribe. This is the right place. So let's just jump right into this. So I talked last night about the doctors say the darndest things. Hi, Carol. Doctors say the darndest things, and one of them is no. So if you have a doctor and you're wanting to have an informed conversation about hormones or anything really, but about hormones, and they're like, no, don't do hormones. Don't believe them like Santa Claus. It's not Santa Claus. There is research-backed science. And if they won't have a conversation at all, if they just shut you down, then say, next, see ya. Or let us check your hormones and help you. So they say, no, get out. You're too old or you're too young. And so I think I have the live replay from last night, so I won't go back through all that. But a lot of that data came from a study in 2002 that what came out of that was that it showed benefit, the most benefit, if you can start perimenopausal, early menopause, that you get benefit after 5 or 10 years from menopause, because what happens is we dry up and we don't have any ovarian hormones anymore. And so whoever took the leap and said, you're too old, doesn't mean just because you don't have the benefit of the maximum benefit of starting early, doesn't mean that you're ever too old. And that 2002 study took women over the age of 65, 62 to 65. And yes, they started having some issues, but they were also giving them synthetic oral hormones. And I talk a lot on this channel about all the problems with that. So I just want to separate that everything that I'm talking about, if you can suspend belief about estrogen for a minute being dangerous, and just kind of go with this, that there is so much more to the story. But whenever I talk about hormones, benefits, I'm always talking about bioidentical topical forms that do not go through the liver. So I just want to kind of set that stage a little bit, okay? And as we go through tonight, I think we'll unpack that just a little bit more so you'll have a little bit more understanding. Okay, they cause cancer. So we talked about that last night. Bioidentical topical hormones protect you from cancer. It's just the opposite. And unfortunately, because all big pharma knows is these synthetic oral forms, well, there are some bioidentical forms from commercial pharmacies that doctors will prescribe, but if they are through the oral route, it's very different. And I'm going to show you some graphics here of why that is in just a minute. Okay, they cause blood clots. There was a study called the ESTHER study, the ESTHER study, over 15 years ago that absolutely showed that synthetic hormones going through the liver are dangerous. They specifically showed that bioidentical topical hormones do not do that, and that they are safe. Is the combo patch safe? The combo patch, the estradiol patch, is a bioidentical patch, but the combo patch that has the synthetic estrogen and synthetic progesterone in it is safer than an oral route with a synthetic hormone. But if it's still synthetic, it still has a lot of risk. And I did a video not too long ago about what synthetic hormones are, and they're actually made from petrochemicals, natural gas, and they are byproducts that the oil companies basically figured out that they could crack and distill the molecules and make steroid molecules and then alter them to put a patent on them. And so that's, what we're dealing with. So those are very different than bioidentical hormones. So yeah, it just depends on the combo patch, what it is. So what's the bioidentical patch? Estradiol alone. So anytime you get the synthetic progestins and not progesterone in there, like at the birth control patch, that's still synthetic. So if it says estradiol on the patch, like a Vivel dot or something like that, that is bioidentical estrogen. That answer your question? Hope so. Okay. Let me know if not. Okay. Once menopause is over, you don't need hormones. That's madness. That just makes no sense because menopause is just a year without periods. And so after a year without periods, our ovaries literally dry up and we have no ovarian hormones. So to say after menopause, you don't need hormones, I mean, that makes no sense. And if a doctor actually says that, like, that's crazy because they clearly don't understand the definition of menopause. Are we supposed to be replacing progesterone? Absolutely, absolutely. Estrogen and progesterone work together. And during a menstrual cycle, I'll show you that here real quick. I have this handy dandy board ready to go. And it's still kind of scribbled on it because I was drawing on this last night and I didn't want to like redraw everything. So during a menstrual cycle of 28 days, on average, estrogen drives the first part of the cycle and progesterone drives the second part of the cycle. Progesterone has a calming effect. And so estrogen has so many properties that are so important to keeping cells rejuvenated. But if you have too many rejuvenated cells and cells just keep dividing, then you can have a problem because once cells keep dividing, you can then have potentially tumors and then potentially cancers. So progesterone is the yin to the yang of that to keep that balance in check. And so one of the things that happened out of that 2002 study for the WHI study was they said that if a woman didn't have a uterus, she couldn't get uterine cancer because there was no estrogen dominant influence that could cause cellular turnover and therefore cancer in the uterus. And that's like saying you have shoes, you don't need socks. They work in synergy together. And so any doctor who tells you that you can just take estrogen without progesterone, whether you have a uterus or not, is really doing you a huge disservice. So sometimes, we will have different variations of things that we'll do for patients, but we always do estrogen, progesterone, testosterone, DHEA together because your ovaries make more than one hormone. Your ovaries make more than just estrogen. They make pregnenolone, progesterone, DHEA, androgens of all sorts in there. I mean, it's even cortisol. So your ovaries do a lot of things. They don't just make estrogen. So when I say that's the darn, kids say the darndest thing, it's like doctors say the darndest thing because clearly if they say that, they don't understand the physiology aspect of that. And they're just speaking a narrative of something that they've heard. A safe progesterone is prometrium or bioidentical. If it says progesterone, it's progesterone. If it says progestin, like TIN, then that is a synthetic progesterone. And the difference between a synthetic and a bioidentical progesterone is a synthetic progestin is designed to keep spell them? Okay. Can you see this? Okay. So progesterone, you can read my writing. Progesterone. It's okay. And then progestin. Or progestogen, if you see a gen on the end of it. Progesterone is the natural form. And so a synthetic progestin or progestogen actually will keep you from ovulating and will change the mucosa in the cervical lining so that it can't receive the sperm or be fertilized with the egg. And it actually can cause cellular changes in the lining of the uterus, so it can't implant. And they have actually, over the years, made the progestogen chemicals where it upregulates receptors on the cells. And so it's more effective for not getting pregnant, but now it's more effective for upregulating progesterone receptors on the cells, meaning if you have a progesterone, it's natural, your body makes these receptor upregulation, meaning more of those receptors, then they're hungry for progesterone. And if that is a setup for a progesterone positive breast cancer, it wasn't because you naturally had that. It was because those synthetic progestins upregulated those receptors. They were never supposed to be that hungry for progesterone. So it's really scary. It's really spooky how they have actually genetically engineered these hormones to keep you from getting pregnant and to do things like suppress all your ovulation so that it, quote, helps your endometriosis, when all they have to do is give you bioidentical progesterone to help that. My estrogen level's 288 in the follicular phase. How do I bring it down? Bioidentical progesterone. No question. So if you are at 288, so this is your follicular phase here, which is where you're just now starting to make the follicle, and this is your luteal phase. So if your estrogen is 288 on a blood test up here, the way you bring that down is progesterone actually comes in to pull that down. So absolutely, natural progesterone will take care of that. I'm so confused. Is it two separate patches or creams? So there's a combination patch that has the synthetic estrogen and the progestin in it. And so the only patches that I'm aware of that have both in it, it's a synthetic progestin. But you can get a bioidentical, meaning estradiol, the molecule that your body recognizes, organic, same chemical as the estrogen in your body, in just a patch, and then you could take a progesterone cream separately. I have a lot of women who, quote, fail the patch. They don't like the adhesives. They don't stay on if it's summertime and you're in the pool or hot tubs. And I just have one of the girls that works for us had a hysterectomy with ovaries until definitely no HRT. Okay, so that's not true. And we'll talk about that. Hysterectomy with both ovaries out. So we'll talk about that in just a second. But a lot of people don't like the patches. And I have one of the ladies in our office recently just said these patches aren't working anymore. And she, went on the creams and she's like, it was a game changer overnight. So yeah, I'm not a big fan of patches. They work for some people and they like them. But for most people, they start wearing off at about 3 days. So you have to change it twice a week. And I actually filled a prescription 4 patches one time, and I was like, I'm going to try it. And I just feel so balanced on what I do that I was like, it's still sitting in my cabinet somewhere, because I'm like, I'm not messing with, once you get it right, you just don't want to mess with it, right? Because I am a hot mess when, sorry, I'm a hot mess when I can't talk. Sorry guys, I've had a head cold and all the things, sore throat this week, so I'm kind of getting over that. But yeah, once you get your hormones balanced, you don't want to mess with them. I used to do a lot of public speaking in my town where I live, and there was a lady who would invite me from the hospital. And so I remember one time she was introducing me, and she said that she'd run out of her cream, and her husband was actually in the garage trying to saw this thing open to get the last little bit of cream out for her. That was always the funniest story that she'd always introduce me and tell. So once you get good on something, it's like, don't mess with it, right? So the creams, because they bypass the liver, super, super safe, super, super effective. Okay, increased sensitivity to estrogen and recent evaluation considered HRT contraindicated. Okay, so and histamine, high doses of estradiol made it worse. Okay, so I'm going to write histamine. I'm going to come back to that in just a minute. Okay, and then I want to answer the question about the hysterectomy and oophorectomy, which means that's the uterus and both ovaries. So if that's happened and they're telling you that you can't have HRT, they are going off information that was from the WHI study that was dealing with synthetic progestins and estradiol, that is the synthetic version from petrochemicals, which also have carcinogenic properties. I mean, we know that plastic is made from petrochemicals, right? It has carcinogenic properties, right? Like BPCs and stuff like that. So we know that. But what they did was they took synthetic hormones, gave these people in the WHI study. But here's what I want to point out, if you guys are kind of new to this, is that study that in 2001, 70 to 80% of women were on HRT, synthetic, but HRT. In 2002, the study came out and scared everybody. And everybody after that said estrogen causes cancer. So if your doctor says estrogen causes cancer, you're going to want to pay attention to this. This is really important, okay? In 2003, after everybody came out and said estrogen causes cancer, we went to half of women being 70 to 80% to 30% being on HRT. They literally threw their hormones in the trash and said estrogen causes cancer. And I won't go through the whole study. I actually have a video on that. But basically, it was so misrepresented on every level. I mean, I can't even begin to tell you the gross negligence of the presentation of that information. But here's the number one thing. This is why I say you really want to pay attention to this. In that study, they took a group with estrone, which is the synthetic form of estrogen, and they took a group with estrogen and the progestins. So you've got one arm of the study, estrogen only, one arm of the study, estrogen and synthetic progestins, and one arm was a placebo, so I had nothing. So we'll just take them out. So you have two arms, one with two things in it and one with one thing in it. And this one thing, this was estrogen and this was a synthetic progesterone. So these are both synthetic. And this was estrogen only, synthetic estrogen, okay? They started to see some concerns with, actually, it was more heart stuff maybe than actually breast stuff, but they had a few more instances of breast cancer. And again, beyond the scope, I mean, it was just so misrepresented. There's a difference between absolute values and relative values. And they also made a leap with causal versus, you know, they had no direct connection. It was like one extra person got breast cancer. They didn't take out anything as far as if they were smokers or were obese or if they have a genetic predisposition. Nothing. Didn't check any ER receptors, nothing like that. And so anyway, okay. She's referring to ER and high grade serous ovarian cancer, which wasn't discussed in WHA. Referring to ER and high grade serous ovarian cancer. There were some aspects talking about ovarian stuff because we're talking about ovarian hormones. I have to actually say that I am not sure. I will have to go back and look at that study a little bit more because I can't say specifically that there was not specific looking at ovarian cancer in that study. So yeah, that's a good point. I can't say that. We're talking about breast cancer though, because that's what scares everybody. So one arm had the estrogen and progesterone, and one arm had the estrogen only. It was this arm that they stopped the study for. This arm went on for a couple more years, and we actually have data from that study. So the only difference between these two things is the progestin. It wasn't the estrogen at all. It was the progestin arm. So how doctors can say that it's the estrogen, it seems like just a really strange stretch that just doesn't even make sense. BHRT are not prescription. They are prescription strength, but we can't do it by, quote, prescription without you actually seeing me. But our coaches go by our protocols, so we can actually do prescription strength without actually having to have a prescription, which is wonderful, which will allow us to get 50% of the population on hormones without having to deal with doctors, because most doctors won't test. Most doctors won't even have the conversation at all. And then they say things like, you know, you can't because you've had cancer. So yeah, that becomes just a crazy conversation. Okay, so what's our next thing? We talked about you're just getting older. No, you're not just getting older. Your hormones are declining. Your ovaries are drying up. It's probably just stress or depression. Yeah, and almost 40% of women after the age of 50 or even 40, I mean, it's like they say after menopause, but are on some sort of antidepressant. So that's crazy. Okay. Bioidenticals are just marketing hype and compounding pharmacies are not FDA approved. Okay, well, that's not true. And that's a narrative that comes from this whole pharmaceutical company thing. I mean, it's like, because estradiol is estradiol and a synthetic ethinyl estradiol is a synthetic ethinyl estradiol, but a bioidentical estradiol is FDA approved. The only thing that's not FDA approved is when someone in a compounding pharmacy actually doses you according to your labs, or our chemist makes this and we dose it according to your labs. The only difference is it's still FDA approved estradiol. It's just you would have to have 10,000 women with they would have to be your clone to actually, yes, bioidentical progesterone cream. That's what we do. Yes. You would have to have 10,000 women who are your genetic clone to do a study with all the variables, on that particular dose of that cream. I mean, I'm exaggerating, but you can't do studies on individualized people when you're dosing something. Now, if you have an estrogen patch that's 0.5 milligrams, then you can test that particular dose on, a population of people. So compounding pharmacies are not something, they're not quacks. They're not something new. They have been around forever. The original pharmacies were compounding pharmacies, and compounding pharmacists have always been able to individualize things. I mean, almost all the veterinary pharmaceutical stuff that comes out is compounded and for kids, I mean, pharmacists can actually make different flavors of, stuff. And, the chemists can make the creams we have all natural, organic products in our stuff. And so we can say, we don't want the synthetic stuff. We want this, we want this, we want this cream that helps it absorb better. And so our chemist has spent a long time studying the very best way and delivery products to get it into the body. And it's so cool because our chemist actually worked with the original founding father, Dr. John Lee. And Dr. John Lee, he's not living anymore, but he was the founding father of bioidentical hormones. And in fact, I had a woman, this was way earlier in my practice, and she was from California, and there's a lot more progressive stuff out of California. And she said, can you write me my bioidentical hormones? And I'm this little doctor down in nowhere, Arkansas. And I'm like, I don't know what that is, but sure. And so I pretty much just signed off on the script, wrote it down exactly as it was on her bottle. And I started studying, and oh my gosh, it was such a God thing, because I was like, this is crazy. And so I ordered a bunch of Dr. John Lee's books. And so, I mean, it's just he's a legend. And so for this chemist to actually have made Dr. John Lee's compounded hormones, I mean, it just wow. I mean, it was such a blessing to be able to find this guy. And he's so interesting. I mean, just total nerd. We totally nerd out together. So he's the best of the best. So I'm so excited. Okay. Pills are just as safe as patches. They are not. And I'm going to show you this little picture of the liver here. So here's the liver, my nice little liver I drew. And inside the liver are these different enzymes and these factors. And so there's one called intrinsic, which means inside. And one of these is extrinsic, which means if you have trauma to your skin or something. Hi. Let's see, how do we know if we're on the right amount? So testing, and it's so funny because doctors will say you don't need to test your hormones, right? But if you didn't have a thyroid, would they say we're not going to check your thyroid? They wouldn't. Or would they just say, here's a dose, this might be the right, and then you're like, how do I know I'm on the right thyroid? And they're like, oh, let's just guess, thyroid dosing comes anywhere from 5 to 360 milligrams. And so it's would they ever do that? Would they ever not check your thyroid levels? Would they ever just throw you on 360 milligrams of thyroid? Or would they ever say, we're only going to give you the lowest dose possible? And, if we have to up it, because hormones cause cancer, because thyroid's a hormone, right? They would never do that. And yet women flatline after the age of 50 on their ovarian hormones. And they're like, oh, we're only going to give you the smallest amount possible. Sorry, honey, those are going to cause cancer. That is just unbelievable. Just unbelievable. Yeah. No need to test. Totally dismiss. Yeah. So, okay. Get our test. Go to hormonebliss.com, order a test, and we will test. It just makes me so mad. It's you guys, my tribe, it's so up to you to spread this word. I can do there's a lot of people. I have 2,000 or 3,000 people on TikTok every night, but it's up to you to spread that word that this is just crap. Do you treat imbalance with natural hormones like wild yam cream? Yeah, you can do some things with wild yam and with um, supplements and things like that. But I always say there ain't enough wild yam cream to handle this girl's menopause issues. I mean, I'm just a hot mess without them. And so I don't sleep. I'm grumpy, hot flashes, night sweats, soak the bed. I mean, and a lot of people who don't have hot flashes don't understand how bad they are, how crippling they are. It's not just like you sweat a little bit or you feel a little hot or shiny. I mean, it is like this rage that just comes inside. And then like the night sweats, it's a whole nother thing. But um testing is a single point. I wouldn't give useful information because it'd be many points. Yeah, so is thyroid. Would they ever tell you, well, your thyroid fluctuates throughout the day, so we don't need to check it? I mean, that's madness. I mean, why wouldn't you want a baseline? And I will tell you, if we check your hormones after menopause, which is a year without periods, it means absolutely nothing. You're an ovarian failure. If we check your estrogen, progesterone, testosterone out there, it's almost zero. So I guess you could argue that that's normal because you don't have ovaries anymore. But it is just absolute madness because it's like, wouldn't you want to see how much you have? Because you might have a little bit, right? Your adrenals might be making some. So why wouldn't you dose that according to what your levels are instead of just telling you the lowest amount or the lowest dose? And I'll tell you, the lowest dose is not enough to protect your heart and your brain and your breasts and your lungs and your I mean, it's just crazy. So the lowest dose just to help symptoms is not optimal to protect you, because once you are an ovarian failure here, that is for life. And 100% of women will experience that flat line. And so it's like it's I would say it's clown world. It's just absolutely insane. Night sweats. So night sweats, bioidentical hormones, absolutely. But you need the balance of the estrogen and the progesterone and the DHEA and the testosterone. You need the balance of everything. Once you get that right, within a day or two, you won't be having night sweats or hot flushes. Now, I always say we don't always get it right out of the gate, but our commitment is always to stay the course until we get it dialed in perfectly. And is every day perfect? No, there's going to be good and bad days and stress and cortisol changes and things like that, but 99% better. So that is always our commitment. So if you are struggling, get a test kit and let us help you with that. Used to raise testosterone. Testosterone is used to raise testosterone. That's what we do. I love it. Do you use estriol in addition to your creams? Absolutely. So there are 3 kinds of estrogen that she's talking about, and that is estradiol, estriol, and estrone. We would never use estrone because that's what the synthetic estrogen is that was in that study. And naturally, we make estrone, but it is a bit of a wild card. I always say it's the crazy little sister in the family that just party in and doesn't behave all the time because she's like, yay, wow, let's go create some breast cancer if you let us go too long. And estriol is the estrogen that is like a fire blanket on estrone. So it's very, very protective. So even if a woman has had breast cancer, you can give a woman estriol all day long because estriol does not convert into estrone. And you can still, it's not as strong, but you can still get a lot of benefit from estriol alone. But if you're doing bioidentical topical estradiol, I don't worry about that at all. And it has a protective effect. Oh, yeah, you said histamine. Sorry. Okay. Progesterone actually will calm down estrogen, right? They grab onto each other and they balance like a yin and a yang. So if you have estrogen dominance, you can absolutely have histamine intolerance. And so for you guys that don't know what histamine intolerance is, histamine is the part of your body when you have an allergic reaction that fires up. And it might not be like a full-blown allergic reaction, but your histamine receptors, when they go off, you can have everything from itching, wheezing, internal like hot flash, angry, nerve inflammation. You can feel sick, nauseated. So that's why we take antihistamines like Benadryl if you're having like an allergic reaction. So that's an immune response. Progesterone specifically calms the immune response. And so if you have trouble with histamine intolerance, yeah, there's histamine diets and things that you can do. But the problem is the hormone imbalance. That's the underlying cause. And just had one of my coaches asked me, someone had called in, and if that was any of you guys, about itching. Absolutely, itching can be a histamine response. So progesterone will calm that estrogen effect. And so that's one of the reasons too. That's why I say it's like shoes, you don't need socks. That's just absolute madness because you need the estrogen to calm the progesterone. If you're still, or you need progesterone to calm the estrogen, if you're still menstruating and you are prone to estrogen dominance, you are more prone to that histamine response. Genetically, there's a condition in the liver called DAO, and not to get too complicated there, but people who have that genetic predisposition have more propensity towards histamine issues. So to me, it's just get the hormone balance, and then you don't have to worry about all the genetic testing and all that stuff. I mean, I'm a nerd. I love that genetic testing, but okay, histamine. And then there was another question I think that was asking about estrogen or something. But okay, I'm going to keep moving. And if I miss that and you want to bring that question back around, please do. Okay. HR creams don't absorb into the body. I hear people tell me that their doctors have said that all the time, or you might have heard that from a doctor. I've been doing this specifically for 23 years, and I have seen life-changing, life-saving benefits of hormone creams. Saliva testing, I've done it. We added up one time that I've seen almost, if not over, around 30,000 patients in my 25 years in practice. And I would never, never, never tell anybody these things that I'm telling you with the research that I have studied and all the nerdy science. And above all, like, do no harm, right? That's the oath that we take. Freezing up. Oh, just TikTok. Yeah, we're having trouble with TikTok. Is anybody else having trouble with it freezing up? But anyway, so I will tell you, they do absorb. See it all the time. I personally do it, so it's thing, and it does absorb. And there's a lot of science in the bases that help it absorb. If it didn't have all the specific, oh, sorry, Constantina. And you can go watch the replay later too, Constantina, if it's not working. But there's tons of research on these specific emollients and things that help this absorb, and these are all natural ingredients. So how do you titrate DHEA? Checking levels, checking testosterone levels. A lot of people, and I'm one of them, I'm pretty sensitive to testosterone. I love DHEA. It's fine for me. Sometimes if I get too much testosterone, I get a little mustache, and it's like a little acne. So DHEA works perfectly for me for a postmenopausal androgen. But a lot of people love testosterone. I do not recommend that people go get pellets. I had somebody tell me just today that someone had put pellets in her and never even checked levels. That is absolute madness. So this whole thing has like gotten so out of hand that it's like someone would put a Tic Tac full of testosterone in you that's going to last for 3 to 6 months. And it's going to send your levels up in the potentially 800 to 1,000, which is a male's levels, and never check a level or a follow-up level. Oh, and that was something I was going to say too. Somebody said that the doctor said that you don't need to check levels because they fluctuate. But it's like, wouldn't you want a baseline, and wouldn't you want to know what you're treating? And if you're estrogen dominant, you are estrogen dominant throughout your whole cycle. Some people believe that it's just during the follicular phase right before ovulation. No. And I even have women postmenopausal who are still estrogen dominant because your belly fat, your visceral fat, actually will convert androgens into estrone. And so you can be estrogen dominant with the aggressive little estrogen molecule and still have problems. So I say, why not check? If you are really interested, you can do something called a Dutch test, which is a dried urine test, and it checks all the metabolites of estradiol, estrone, estriol. to me, you're doing topical bioidentical hormones. You're not going through the liver. Super safe and super protective. I have absolutely zero fear of it causing any problems. So, to me, all those metabolites aren't really necessary, but I'm a nerd. Of course, I've done it on myself and I've done it on a lot of my patients. And it's cool information to have, especially if you have a risk of family history of cancer. So it's nice to know that your estrone isn't through the roof, because you might need to take some diethylmendolivine, which is DIM. And if you know that your estrone levels are high or family history of breast cancer, I highly recommend that you take some DIM. And if you go to my link in bio, there's a link tree. And actually on one side are all the free downloads. And on the other side is my shop page. And so we actually have the DIM menopause support. But this is the same stuff that's in green leafy vegetables, the indoles, and it actually blocks that conversion. Oh, I don't have it up anymore, but blocks that conversion into the crazy little stepsister that goes a little nuts called estrone. So that's pretty cool. But you can check your levels if you want to. I mean, it's might not completely necessary, but if you have had a family history of breast cancer and you want to be as preventive as possible and really get your estriol levels up and your estrone levels down with something like this, perfectly understandable. Okay. Let's see. 11. If you don't have a uterus, you don't need progesterone. We already talked about that. It's the yin to the yang of each other, right? So, I mean, it's like saying you have shoes, you don't need socks. You absolutely need progesterone. And when it comes to things like blood clots, estrogen actually makes the blood vessels more pliable. So it decreases things like heart disease and blood pressure problems. It keeps your arteries from getting stiff, like atherosclerosis. And the progesterone actually has an anti-inflammatory effect. So if you want that anti-inflammatory effect, because all cancers, all heart disease, all of that is inflammation related, and even aging, like your skin, we call it inflammaging. It's inflammation that does that. And so I'm 55. I feel like I'm doing pretty good. So I really attribute that to starting my bioidenticals early, because I think it was a gift too, because I had a hysterectomy when my son was little, and I was still kind of playing around with the science behind all this. I've learned so much over the years, and I don't miss my uterus a day. But at the time, I really didn't think there was another option, and I had an ovarian tumor, and so that's where I was. But I started bioidenticals right after that, because that lady came in my office and asked for bioidenticals, and that was a total God thing. And I really feel like the protective benefit of me having something all these years, that when it finally came to, I hit my one ovary I had left just shut down at 50. It was like I really had the protective benefit, and I want that for every woman. And I saw my mom, she had Alzheimer's, she had broken hips. I mean, it was like, I don't want that for myself, and I don't want that for you guys either, because it's horrific. It's absolutely horrific. So anyway, that's all I say about that. Okay. Testosterone's only for men. Women actually make more testosterone than estrogen. I know, crazy fact. Men have a lot more testosterone, but we actually make more testosterone in our bodies. So if you were to map, I don't have it up there, but if you were to map our estrogen levels and our testosterone levels, when I see women after menopause and ovarian failure, which is our ovary shut down and we're done, they'll usually have a little bit of testosterone. Not everybody, but they'll have no estrogen, but they might have just a little bit of testosterone. And that's because your adrenal glands make androgens, which are male hormones that we think of male. I mean, we all have the same hormones, boys and girls. But we make a little bit of androgen from our adrenal glands that then gets stored in the visceral fat with these enzymes called aromatase that convert that. And then we end up with a lot of estrone, but we always have more testosterone. So it's not just for men. Okay, your weight gain is just you need to eat less and exercise more, or it's just inevitable because you're getting older. That is not true. I'm 55. And yes, I do exercise. I know the shirt makes me look really big, but I don't feel like I'm overweight at all. And my BMI is not. And I do exercise, and I do strength train, and I do try to behave with, my eating, but I don't calorie count ever. And I know that when I went through my actual natural menopause, meaning my one ovary I had left shut down at the age of 50, I gained 15 pounds in 6 weeks. And I really think that was God's gift to me too. It was horrible at the time, but I really believe that was showing me that when everything crashed, I had to get that hormone balance back. And it took me, a couple weeks to really get that right. I'm like, what the heck is happening? And I didn't really want to change my hormones because I'd been on them for like 10 years. And then I'm like, something is really, really, really wrong. And so, that was like, I had to reset everything, had to test again, had to see where I was at. And then it would just get in the balance and had to test again. So I literally crashed that day. I was having a birthday party and I was telling my friend that was there, I was like, I am so like, oh my gosh, my life is over. And I was just like crying and sweating. And I just like was losing it. And I was like, okay, we got to get this under control. So I've been there. I've been where you are. I totally understand. I love you. I get it. We're in the club together. Okay. Um, and I've seen women on estrogen alone, just so you know, people have been asking about estrogen, gain 5 to 15 pounds a year. Progesterone has a very balancing effect to estrogen because if estrogen just keeps converting into estrone and it causes more cortisol, more belly fat, upregulates those aromatase enzymes, now you're dealing with this perpetual weight gain thing. And then insulin, your sugar storage hormone, gets unbalanced. And then you literally look at a carbohydrate and it gets stored. So all of those work. I mean, God made them perfectly to react in us. I'm not sure why we have to go through ovarian failure after we don't have periods for a year. I mean, I know why. I mean, we literally run out of eggs. We have all the eggs we're ever going to have. But I'm not sure what that plan was about. And I always say, if I'd been brought in on the planning committee for women's ovaries and uterus, I'd have been like, I don't think that's such a good idea, but I wasn't. So here we are. Okay. Estrogen will make you gain weight. Okay, that was a perfect lead in on that one. So, yes, estrogen alone, if you take it, I don't care if you're just taking bioidentical topical estrogen cream, you will gain weight if you don't have the progesterone to balance it out. I mean, not everybody. Rarely I have a woman who comes in and she's got this metabolic issue and she's like super skinny or probably a smoker because they're usually pretty thin, but trying to gain weight. And that's super rare after menopause. So I'm not saying it can't happen, but you absolutely need that balance. And, I've seen women who come in and they've been on an estradiol pill for 10 years and they're like 60 pounds overweight. And they're like, I don't know what happened. I don't do anything different. I don't eat any different. I'm like, I believe you. I'm like, you just needed some progesterone. Okay. You can't use estrogen if you've had a family history of breast cancer. So we know now that bioidentical topical estrogen, progesterone, testosterone have a protective effect. And if you go back and look on my main page where all my videos are, I did a video the other night all about breast and all the receptors. And just, if you go watch that, you can see that it's clown world to say that because you've had a family history. Because you've had a family history is all the more reason that you need your protective estriol, that you need your protective balance, because younger women usually don't get breast cancer. Yes, they do. It's definitely not as common as when we're in ovarian failure after menopause. Our bodies were designed to have that balance between the estrogen and progesterone. And when we don't have any, there's nothing to balance. And if we have visceral fat that's only making the problematic form of estrone, we are at high risk. Yes. Taking synthetic hormones, and I don't want to scare you or make you feel bad if you took birth control. Those synthetic hormones actually did increase your risk of breast cancer because what they do is they upregulate the estrogen and progesterone receptors on the breast. And if you have that genetic predisposition, that is a recipe for disaster. So the longer you take those synthetic hormones, the more potential you have of having a setup for a problem. But taking bioidenticals balances that out and reduces your risk. And I have no problem saying that. Yeah, and don't worry, Constantina. I mean, it is what it is. We have great immune systems. It is what it is. I had a hysterectomy. Wish I hadn't, right? But it's fine. You're going to be fine if nothing's reared its head. But the fact that you're, exploring bioidentical hormones is all the more reason that you should do that because of that. Okay. If you're bleeding, you probably need a hysterectomy. Hysterectomy is the number one neck and neck with gallbladder surgery in the US. The response to hormone problems seems to really be if it's a problem, just cut it out. And it's a hormone imbalance. I always say removing the uterus does not fix the hormone imbalance. So, okay. If you're not sleeping, you just need to stress less. I cannot tell you the times that I have had patients tell me, my doctor just said reduce my stress. My blood pressure is high, just said reduce my stress and take this medicine. So it's like, just take a sleeping pill, right? No, progesterone decline is the number one cause of not sleeping. And that's why women in perimenopause in their 40s, when your progesterone declines first, that's why you stop sleeping. And so, you need some progesterone. Just get some progesterone and you'll sleep again. You don't need testing. We talked about that. That's stupid. You need testing. I mean, that's just crazy. You wouldn't do anything else. You wouldn't put a diabetic on insulin without testing their insulin levels. You wouldn't put somebody with thyroid issues on thyroid hormone without checking their levels. The ovaries are just another endocrine organ. Why wouldn't you check? I mean, it's just clown world. I can't even. Okay. Hot flashes. If your hot flashes aren't bad, you don't need hormones. What about all the protective effects? Hot flashes are just the canary in the coal mine telling you that there's a problem, right? And so, like, when they say, I'm just going to, okay, well, if your hot flashes are bad enough, I'll just give you the lowest dose to help those hot flashes. Like, that's a drop in the bucket. And a lot of women, probably 30 to 40% of women don't even have hot flashes because their thyroid usually goes out at the same time that they go into ovarian failure because estrogen and thyroid compete with each other through the liver. So if you're cold hands and feet from your low thyroid and you're hot from hot flashes and that balances out, then you're not going to have hot flashes, but your bones are still crumbling and your heart is still crumbling and your breasts are still getting inflamed and your blood vessels are getting inflamed. My mom, who had discontinued HRT when all the false studies came out, restart in her 70s. Absolutely. Absolutely. And that was one of the first ones that, am I too old? Yes, she would be too old if you wanted to put her on synthetic hormones in the oral form, but getting her on some bioidentical creams, absolutely. And I had a woman, this is probably one of my most extreme cases, but a patient she just started with me a couple months ago. And she had begged her doctor since the age of 52. She had gone into ovarian failure, which 100% of us will after menopause. And for 20 years, the lady is 72, for 20 years begged doctors to check her levels or give her some hormones. And they kept saying, oh no, that causes cancer. We're not going to do it. I don't believe in that. Like Santa Claus, not going to do it. Don't you know all the studies? And so, of course, she met me. We tested her, started on hormones, changed her life. She said, you know what? She said, I had just learned to live with it. And she said, I didn't sleep through a night for 20 years. I had debilitating hot flashes, night sweats, absolutely miserable, crying all the time. And so finally, we get her on hormones. She said she slept so good through the night one night that someone called early in the morning and she was still like groggy. And she was like, that hasn't happened in 20 years. So I'm like, absolutely, absolutely. So get your mom a test kit, go to hormonebliss.com, get her a test kit, and give that poor lady some hormones. Oh my gosh. Okay, so I got through that list. I know we only have a few more minutes. I'm not sure if I want to do a part 3 for this or not. But I think I'll just kind of run through these a little bit and we can break some of these things down. Number 21, hormones won't help with weight loss, so that's not true. blood tests are the only accurate test. That's not true. Our lab that does the saliva test, which is super convenient because we can mail it to your house and it's only a little over $100. And we have a Valentine's special going on. And TikTok 20 is the same as our Valentine's special. So it's $20 off the $129. So it's only just a little over $100 to do a test. And if you could get a doctor to do it, it'd probably be $600 or $700 through Quest or LabCorp. So super cheap, but the saliva tests are very effective and it's so convenient because it just comes to your house and you just fill the little tube with saliva and you send it in. Free shipping back to the lab. And also included in that is a visit with one of our hormone coaches who goes over this, which is what you fill out before you send it in, with like 70 different symptoms, everything from, I always say frozen shoulder, that's on here, joint pain to and hot flushes and night sweats are on here, but there's the weight gain, there's the water retention, there's the bloating, there's the puffy, there's the foggy brain and heart palpitations and wet in your pants and being tired all the time and not sleeping and your muscles going away and all the things. So yeah, order your kit and order your mom a kit or order your sister a kit, whoever you know, or whoever you want to protect. I mean, it's all not all symptoms. And I know you guys are miserable. And I know that if you found your way here, that, you know, there's help. And I just so want you guys to have the help. Okay, so that's not true. I do both. I do blood tests in my clinic. I do saliva. We do all of it. I've been doing saliva tests for 20 years on people, and they're very, very accurate. Now, it's apples to oranges. So checking a saliva test versus a blood test, you have to convert the levels a little bit. I like to stay with saliva if we're going to do saliva. I like to stay with blood if we're going to do blood. So, I mean, we can mix and match a little bit, but if I'm trying to dose creams, I like to stay. And the other thing about saliva testing is if you're doing topical creams, this actually measures the amount of hormones that are in your tissues, not just what's in your blood. So we have free and total hormones in your bloodstream. And so the free is actually what's available, which is a better indicator of your hormones, but not the same as what's actually in the tissues and the capillaries that we are measuring. Thank you. I'm the daughter of OB/GYN who said that false info. You know, it's so frustrating. I have heard that so much, and they just get indoctrinated. And I know I've been, you know, I went through residency. I'm a medical doctor. I get it. All the things they tell us, and you're just like, okay, because you trust these people, you trust the attendings. And I have a dear friend, and her daughter is, I think she's an ER doctor or something, and she's just so like this, and she's like tries to tell her daughter stuff, and she's like, oh, that's not true, because that's not what I heard. And I have people tell me all the time, my doctor told me I can't take hormones. And I'm like, ask your doctor what hormone, thyroid, insulin, which hormone, GLPs, I don't know. And then when they say, okay, estrogen, say, well, it wasn't even estrogen arm that everybody's concerned about from that WHI study, and it was the progestin arm. And then if you're going to say, okay, progesterone causes cancer, then tell me exactly, you know, what that was that you think that, and tell me the difference between bioidentical, meaning the same organic structure as our body, versus a synthetic natural gas petrochemical. I mean, you can't make this stuff up, right? So I totally understand. Cholesterol causes heart attacks. If you go back and watch my cholesterol video night before last, like I told you guys like 30 different things that cholesterol does. Cholesterol does not cause heart attacks. There is a lot more to the story. I know I just made a bold statement and I stand behind it. So go watch that video. If you start hormones, you'll be on them for life. You'll be addicted. Yes, you will. And you will love it. You don't have ovaries anymore. They literally dry up. If you look on an ultrasound 10 to 15 years out from a year without periods, which is all menopause is, once you're an ovarian failure, you don't have those ovarian hormones anymore. I check women all the time and it's like zero, like non-detectable. Yes, you will be on them the rest of your life. I absolutely will be, as long as someone could slap some cream on me in my old age. I'm like, I'm not going down without a fight because I don't have ovarian hormones. It's like having your thyroid out. Would they ever tell you you can't take thyroid hormones? And so people ask me how long, and I'm like, till science can figure out a way to regrow ovaries, I will take my bioidentical hormones. Leaky gut isn't a thing with hormones. Absolutely, they are. The microbiome in the gut is regulated by estrogen and progesterone. Supplements don't help with menopause symptoms. They absolutely do. You can take black cohosh or evening primrose oil. Absolutely helps with things. Definitely want to get nutrients. I love and this is in our shop page, but our fruits and greens, they're like super delicious and has like your whole daily multivitamin type allowance in it, but it's got probiotics in it and stuff. So supplements, I believe in them. I probably take 20 supplements a day, maybe even more, because we just can't get what we need from our food supply. So absolutely, supplements are amazing. And if you have joint pains and aches and inflammation, absolutely methylfolate. I'm all about supplements, but I always say there ain't enough, yam cream to like take care of this girl. So there's not enough black cohosh to help my hot flashes. So if that works for somebody and that's their choice, I still don't believe that they're getting the protective benefits of having adequate levels of ovarian hormones. But if that's your choice, that's your choice. And so I even know sometimes people are like, just, got the blinders on. They're like, I had breast cancer, I had this, I had that. And even now, breast oncologists are coming around to these facts. And not all of them are stuck in this like narrative. There are a lot now. And I actually have some patients who've had breast cancer. Their breast oncologists are totally on board with me. Now, I have some that are still totally stuck in that other information and so into chemotherapy and so into, just surgery and all the radiation and all the things that they want to do. But there are a lot that are coming around now. So it's so helpful. You just need medications. Just take some gabapentin for your hot flashes. Just take some Celexa for your depression. Just take some Xanax for your anxiety. That's all you need. You don't need hormones because they cause cancer. Just, doctors say the dumbest things. I mean, that just doesn't make sense. Thyroid doesn't have anything to do with menopause. Absolutely it does. And I have women all the time who get their hormones balanced, their ovarian hormones restored, and their thyroid gets fixed and they get off thyroid hormone. I'm not telling anybody to stop any medications or that we're going to tell you to stop any medications, but thyroid is absolutely regulated by estrogen. Bone density meds are safer than hormones. That's absolutely crazy. It's kind of like there was this movement. If you want to look up something creepy and go down that rabbit hole, look up the Nestle Corporation. That's really scary. I have to whisper that, right? But my mother was in the generation that was told that formula was healthier than breast milk because it had more vitamins in it. That is a complete lie. And that cheated me from getting breast milk because my mom didn't want to shortchange me of my vitamins. Unbelievable. I mean, you cannot make this stuff up. I mean, it's just like, wow. So, when we're just sticking people on thyroid hormones and we're telling them it has nothing to do with your estrogen or whatever. I mean, yeah, they were just selling formula. Oh, and then it gets really dark about what they did in other countries and selling bottled water. And it's creepy as can be. So when you ask why don't doctors know this information, you have to follow money. You have to follow the Rockefellers back to the early 1900s. The med schools got bought out. They actually started taking funding away from any med schools who taught any of real science that wasn't in the narrative of Big Pharma and all the research studies that are done, that are funded. Whenever you're looking at a research study, you always have to look and see who did the funding for that. And they're supposed to disclose if they have a conflict of interest, but I don't know, there's shell corporations, right? So I don't even know. I can't even. Estrogen dominance isn't real. I've seen it my whole life because I've had it. And I will tell you that it's real. And it is a progesterone deficiency. And it's so easy to fix with some progesterone. So easy. Okay. You have to have cysts on your ovaries to have PCOS. That is not true. It is a progesterone deficiency. And not everybody has cysts on their ovaries. And hormone therapy is expensive and your insurance won't pay for it. what is your life worth, first of all? And how much do you spend on supplements and going to doctors and copays? And how much do you spend on your insurance a month? I have some patients who spend $1,500 a month on their insurance and they get nothing. They get the promise that if they have a catastrophic event, they won't lose their house. And I've had so many patients who have had catastrophic events that they still put a lien on their house. The hospitals put a lien on their house. So that's not even true. Yes, I have health insurance because like I can, and mine's pretty cheap a month. I mean, it's like $400 a month, which isn't cheap, but I get nothing for that. And people are like, well, I get my meds free. Okay, you get an antibiotic free like every year. I mean, a $5 antibiotic, you get it free. Okay, well, if you believe that. So it just kind of, it's your choice. And yes, some doctors do this and some doctors take insurance. And those are usually the doctors who are just going to put you on the synthetic stuff. And they're really not educating you and they're really not understanding how protective and how beneficial all this can be. And you really want someone to do it right. You wouldn't go to a heart doctor to have brain surgery. And they don't teach this stuff in med school. I promise you. And I know enough doctors to know that they don't teach this in med school. And I know that the doctors that I worked with in my residency program don't know this stuff because I didn't either, and they weren't teaching it. So, I mean, there's tons of studies to show that they actually looked at how much of this doctors are actually taught and know, and it's really scary. And I don't want that for you guys. So I'm starting to get hoarse because it's been a rough week on my voice. So I'm just going to leave you with, please go to hormonebliss.com or my link in bio. There's a link tree and you can order a test kit. And after saying this, someone can take HRT. Bioidentical, BHRT, absolutely not. And, you know, you can go to that place where you can say, well, active breast cancer. I would say don't complicate things. If you have active breast cancer, let's figure that out and get through that because, and I have patients sometimes, like men, I have male patients too. They'll get prostate cancer, right? You can't prevent it. I mean, if you come to me at 60 or 70 years old and you want testosterone, I can't help what happened for the last 65 years. I can't help that you smoked or you had risk factors or family history. So we get you on testosterone. And now, you know, and now they're actually treating prostate cancer with high dose testosterone. We are actually catching up with the clinical is catching up with the research. But yeah, so things happen, right? And so I'll tell them, go off your testosterone until you get clearance, right? So I know 100% in my heart, I would not ever hurt anybody if I had any doubt that this could be harmful. As long as it's the topical route, it's bypassing the liver, it's bypassing those clotting things that are made in the liver, as long as, you know, as long as you're testing levels and making sure that everything is staying in the lanes, absolutely. Had ovarian cancer though, and BRCA1 positive. So BRCA is a genetic thing, and ovarian cancer, a little bit different can of cats, but the ovaries make the estrogen, right? So if there's an imbalance, or you've had a history of taking birth control for a long time, synthetic hormones, and you have those upregulations of those receptors, absolutely, bioidentical hormones, I have no qualms with any of that. And it actually would be protective. Again, if it's an active cancer, I would say get through that, do all the things that you need to do to get that resolution. But as soon as possible. I even have a girl, she was triple negative on her breast cancer. And her oncologist was like, fine, you know, do it. Take your hormones. And actually they have medications that can keep your ovaries from shutting down because the chemicals they do are so toxic. And so I have oncologists that say that all the time. So if you're not getting the answer from your doctor that sounds right to you, then just say next. I mean, because somebody does understand the truth for sure. So, okay. Surgery always removed, did the chemo. Yeah. So there's no reason why now you can't take some bioidentical hormones. So if you can't get your doctor to check and you want us to, and all my protocols, like I say, my almost 25 years doing this, our coaches will work with you and it allows us to do for a large population to be able to check your levels and match you some bioidentical hormone creams and get you feeling better. And a lot of times when people have had their ovaries removed or they've been through traumatic stress and their cortisol levels have been through the roof, it's life-saving and life-changing. So anyway, okay, I'm gonna wrap this up. I love you all very much. I have changed my schedule. I have been here every night at 7 o'clock forever, except the one night that TikTok wasn't doing the lives. But absolutely, I'm going to be here at 7 o'clock on Monday, Wednesdays, and Fridays now, so I can have a little time with my family. But okay, so the next time I'll see you guys, and I'm almost missing you already because the weekend is here. But tomorrow night, I want you to do some research or just chill and watch some Netflix or something and think of me. And I will be back here Monday night at 7 o'clock. And if you have any questions, please feel free to direct message me. And I know a lot of you guys do, and I love it. And as long as I'm not so crazy busy that I can still connect with you guys, absolutely I will. But at some point, my coaches are probably going to have to take that over for me. But they always have access to me. So I am always overseeing everything because this is my heart. And you guys are my heart. And I just want to make sure you get taken care of. So, okay. Love you very much. Have a beautiful night. And I'll see you Monday.